KUAM News brought to you by GTA. We start with you, Subway, and Chili's Grill and Bar.
You may remember the flowchart that Public Health released more than a couple weeks ago, detailing what residents should do if they catch COVID. As of Monday, some changes have been made to reflect the ongoing situation, explained by COVID-19 Emergency Incident Commander Fernando Esteves.
The change that we're going to be making is removing the recommendation to test at day 5 if you're a close contact, as well as removing the recommendation to quarantine if you're a close contact and fully vaccinated. So if somebody's fully vaccinated or boosted and they're a close contact, they can go about their regular day. No testing required and no quarantine required or recommended in that situation.
Esteves added that the testing demand are mainly those who need to return to work, as they are required to show a negative COVID test if they are close contact or tested positive before. Due to this, Public Health reports that there are residents who get tested 2 to 3 times a week.
And what that means is, with the current situation and transmissibility of Omicron, what we're seeing as an example, if somebody were to test positive or be a close contact in one of your radio stations, then there may be the requirement that everybody who works there gets tested before returning to work. Now, what this does is it puts a tremendous burden on our supplies to try to maintain the operations and keep things open. And so for now, because the supplies are not there, we're just going to focus on our primary effort, which is preventing the overwhelming of our hospitals at this time.
It was also during yesterday's briefing that Esteves spoke out in regards to those lining up to get tested.
We hope that people are going to be honest when they come to get tested, whether they have an appointment or try to walk in. And if they're dishonest about whether or not they're symptomatic, shame on them. I'll just say it, shame on them, because they'll be taken away from somebody who may actually need that test in order to be identified and may need to get treatment.
KUAM reached out to Public Health today and received confirmation that they are making changes to the flowchart to update it to reflect what was announced Monday. Public Health hopes to get the updated version out before or by tomorrow. Daniel Perez reporting for Guam's News Network.